Good evening. Come on now, we family. Good evening. There we go. That's what I'm talking about. So oftentimes, people don't know how their decisions affect people's lives. Case in point, I'm standing in front of all of you today to discuss the impact of NMF on my life. And I'm not entirely sure the people who selected me for the United Health Foundation Diverse Scholars Fellowship knew the impact it would make. So thank you, United Health. Thank you. So about a year and a half ago, one of my closest friends, he's like a brother, Dr. Michael Okonroko, he approached me about this idea of having hospital rounds, not only in the hospital, but in our hood, like where we from. And I was like, bruh, how does that make sense? Like, what we gonna talk about medicine with people who don't understand medicine? He was like, nah, man, we could take our life experiences and all the medicine we know and the things we understand about mental health and go have conversations on the blocks where we're from. Like in the highest gun violence areas in New Orleans. And we could change the game. Because these kids never seen people who look like us with white coats on, but talking to them about things that they can relate with. So the next thing I told him was, yo, we don't have money to do this, and it sounds amazing, but where we gonna get the bread from? And he said, yo, that part I don't know, but you figure it out and get back to me. No problem. So the work included providing physical activity in the form of basketball and football, along with strength-based interventions to kids from some of the highest gun violence zip codes in New Orleans. So I stumbled upon this fellowship from the NMF that would allow us to do this exact work in the community that we grew up in. So this is like major. This is like being a hood hero. Now let me stop here and be candid with you. This work is so unique and it's outside the common scope of medicine that I thought it was a long shot to even get funded. But national medical fellowships though. National medical fellowships though. I need y'all to understand something. National medical fellowships is like, yo, we gonna give you the money. We'll let you do it. So we applied for this unique scholarship that also provided us with guidance in how to get institutional review board approval, funding, and people willing to help us guide us through this project. And we got to do it in our own community. Ultimately, we were able to publish 2 amazing papers about the importance of strength-based interventions, along with a paper specifically talking about the importance of a physician-to-patient cultural accordance within the hospital setting of a young Black man who was getting ready to commit suicide, but was also an NFL prospect. And how that work alone, the physician-patient cultural discordance work alone, helped to break down mental barriers to treatment, specifically with regards to mental illness. What I want to share with you about how this funding empowered us to do this, to expand this work into a nonprofit, is that continuing to make these improvements in the community that I so dearly love in New Orleans is continuing now. Like New Orleans recreational department picked it up because they understood the impact of it. But that started home, like that started here. You see, when you give to NMF, you have no idea the people you're helping. You have no idea. Most of y'all don't have no idea where I came from. I was digging in dumpsters for dinner. So when NMF gave me the scholarship to do this work, it hit different. Because there's kids in my community digging in the same dumpsters I was. I'm a 10-year United States Navy veteran right now. I'm a dual degree Southern University trained. Hold on, I'm not done, because there's more flexing to do. I'm a 10-year United States Navy veteran. I'm a dual degree Southern University, shout out to the HBCUs, trained college graduate. I'm a Howard Hughes funded NYU trained PhD scientist. I'm a graduating Tulane trained physician. I'm also a businessman with a nonprofit over $500,000. I'm the co-founder of a nationally recognized nonprofit organization, and I'm an NMF scholar. That's what you're donating to. Like, that's what you're donating to. You're not donating to like some great idea. Now you're donating to humans with souls, real people who making a difference in this world. That's what you're donating to. That's what we need for you to understand. When you open your wallet, you're not donating to an idea. You're donating to real people like me. I'm also a happily married husband of 17 years. And I'm a grateful father of two beautiful queens, Malia and Melina. Yet there's more to this story. I've digged in the dumpsters behind Sam's Club in Lake Charles, Louisiana. I've lighted candles because our lights were off. You are essentially funding the dreams of someone who fought for everything they ever had. And now I want to make a difference in the next generation. Your generosity goes farther than you could possibly imagine. It's not just about the money, man. It's about the impact. And let me confidently say that your giving made a monumental and lasting impact for me personally and for the city of New Orleans. Please don't let up now. Like, this is not the time for you to let up. Thank you for listening, and thank you for your continued support of the great organization that is called the National Medical Fellowships.